Go.
Hi, my name is Danielle. I'm going to be your nurse today. Can I get your name and date of birth?
Alexander Sisterman, 9/21/1997.
All right, and I'm going to verify that with your wristband, and that does match. Now I'm going to go ahead and wash my hands and gather my supplies and provide privacy. I'm going to do a head-to-toe assessment on you today. Some parts of this assessment will require me to touch you. Is that all right?
Yes.
Okay. And if you have any questions or concerns at any time, just please let me know. It should take about 10 minutes.
Okay.
Okay. So right off the bat, your posture, your speech, and your hygiene look good. I'm going to get a set of vitals and your weight and height and your BMI, and all that is good as well. Now, can you tell me where you're at?
Rasmussen.
All right. And who is the president?
Trump.
All right. And what time of day is it?
Morning.
Perfect. You are oriented ×3. Are you having any pain today on a scale of 0 to 10, 0 being no pain, 10 being a lot of pain?
No pain.
All right, perfect. So I'm going to go ahead and start with assessing your hair.
Okay.
I'm going to look for any brittleness. I'm going to assess the scalp for any bumps or lesions or infestations. I don't see anything. Now I'm going to go ahead and assess your cranial nerves. So go ahead and close your eyes. And I'm going to put something under your nose. Let me know what you smell.
Vanilla.
Perfect. Cranial nerve number 1 is intact. Go ahead and cover your right eye. And let me know when you see my finger.
See it?
All right, and the other side?
See it.
Perfect. Cranial nerve number 2 is intact. Now I'm going to go ahead and assess cranial nerve number 3, 4, and 6. I'm going to check for pupillary response. All right, perfect. They are both a 3 and went to a 2. So your pupils are equal, round, reactive to light. Now go ahead and follow my finger. All right, so they are accommodating as well. Again, hold your head straight and follow my finger. Your eyes. Perfect. Cranial nerves number 3, 4, and 6 are intact. Now I'm going to assess for cranial nerves number 5 and 7. Pop out your cheeks, raise your eyebrows, and close your eyes. Let me know where you feel me touch.
Left cheek. Right cheek.
Perfect. So those are intact. Now go ahead and close your eyes again. And if you hear a sound, let me know where.
Left side. The right side.
Perfect. Cranial nerve number 8 is intact. I'm going to go ahead and have you stick out your tongue, wiggle it back and forth, and say ah. Perfect. Your uvula is midline. So cranial nerves number 9, 10, and 12 are intact. Now can I have you shrug your shoulders and push against my hand? Cranial nerve number 11 is intact as well. So I'm going to go ahead and just look at the outside of your eyes, look for any discharge. I'm going to pull down on the lower lid and check your conjunctiva, make sure it's not too red, and that looks good. So I'm going to move on and I'm going to look inside the nose for any discharge, any deviation. I do not see any. Can you occlude one side and breathe? Perfect. Other side. All right. Both sides are patent. That is good. I'm going to have you stick out your tongue. I'm going to use my tongue depressor as well. And your mucous membranes look nice and pink and moist. I don't see any skin lesions or any abnormalities, so that's good. Now I'm going to move on to your ears. I'm going to check the outside for any lesions, abnormalities. I don't see any. I'm going to check the inside for any excess earwax, any discharge, any abnormalities. I don't see any on that side. I'm going to do the same for the other side. I don't see any there as well, so your ears are good. I'm now going to palpate your lymph nodes. I'm going to start with the segmental, submandibular, preauricular, postauricular, occipital, and postcervical, deep cervical chain, and clavicular. I did not feel any abnormalities. Did you have any tenderness?
No.
Perfect. So now that looks good. I'm going to go ahead and assess your pulmonary system. So I'm going to listen to your lungs. As I go through this, just go ahead and breathe as I move my stethoscope.
Okay.
Lift your arm. And other arm. Perfect. Your anterior side sounds good. I don't hear any wheezing or crackles. Your respiratory rhythm and rate is good. It's at 16. I'm gonna go ahead and feel or listen first. And again on this side, just go ahead and breathe as you feel my stethoscope move. And lift your arm. Another arm. Perfect. So the posterior sounds good as well. No crackles or bruising as well there. I'm going to test for tactile thermitis. So go ahead and say 99.
99.
And 99.
99.
Perfect. Every vibration sounds even. I'm going to check for expansion. Go ahead and take a breathe. All right. And that feels symmetrical. I'm going to check your spine alignment. That feels nice and normal. And I'll feel anything out of alignment. And I'm going to go ahead and check for CVA tenderness. Let me know if you feel any tenderness, okay?
Nope.
All right, perfect. So everything with the respiratory system looks good. Everything is symmetrical. I don't hear any coughing or wheezing or anything while I did that. So I'm going to move on to the cardiovascular system. So first I'm going to go ahead and just listen to your heart. And I'm going to start with the aortic, move to the pulmonic, Erb's point, tricuspid, and mitral. And I'm going to stop here for a full minute and check the apical pulse, and that's 74. That is perfectly normal. Now I'm going to go ahead and palpate your pulses. I'm going to start with the temporal, carotid, one at a time. That feels good. Go to your brachial, your radial, ulnar. Your femoral would be next, but I'm not going to physically assess that at this point, so I'm going to go to the palpus heel behind the knee. And then the post tibial, and go to the dorsalis pedis, and those all feel nice and strong, 3+ and even. So now I am going to check your capillary refill on your fingers. All right, that is less than 3 seconds. That is good. And now your toes. And that is nice and good. Your skin overall, I don't see any lesions or any abnormal moisture or discoloration or anything like that. So I'm going to have you lay down so I can assess your abdomen. And I would have you pull your shirt up, but for this I am not going to do that. So first, I am going to go ahead and listen to your bowel sounds. I'm going to start in the right lower quadrant and go clockwise. Okay, and I'm going to listen for a full 3 minutes. If I don't hear anything, I'll listen for a full 5. Everything sounded good, so I'm going to go ahead and percuss in the same order. Everything feels good there. Now I'm going to palpate the stomach. If you have any tenderness, just please let me know, okay? And again, in the same order. Did you have any tenderness?
No.
All right, and your last bowel movement?
This morning.
Okay, and last time you urinated?
This morning.
And did you have any pain or discomfort with that?
Nope.
Perfect. And your last menstrual cycle?
Last month.
Perfect. I will have you sit back up. And now I'm just going to go ahead and assess your reflexes. So I'm going to start with your bicep right here. And just go ahead and relax. And I'll do your tricep and your brachioradialis. All right. And your patellar and your Achilles back here. And then while I'm down here, I'm going to test for your plantar reflex and then your ankle clonus. And that all feels good. Can I have you go ahead and raise your arms up and move them around? Perfect. And same with your legs. Awesome. And then move your head back and forth. Okay, range of motion looks awesome as well. Now I'll have you hold your arms up like this and push, pull. Same with your legs. All right, and your strength feels great as well. I'm gonna have you stand up. All right, and I'm gonna check your balance, so I'll have you close your eyes and stick your arms straight out. Perfect, that looks good. And I'll have you walk a few steps and come back to me. All right, your gait looks great as well. So that is the end of our head to toe assessment. Do you have any questions or concerns for me?
I do not.
All right, and I'm going to document my findings, and thank you for participating in this assessment.